we have a leadership crisis in healthcare. We have generations of leaders who've been financially successful and personally successful without necessarily the concomitant, performance improvements in healthcare. And so I think we have to start taking a hard look at ourselves, those of us who are in charge of healthcare organizations, and challenge ourselves to be better. I think that includes management teams. I think it also includes board members, and we have to stop normalizing the abnormal. And that's, I think, the real pathology. That's the starting point for us to really reimagine healthcare, which is we have to stop normalizing the abnormal, and we have to stop papering over the abnormal. If you meet with management teams of top insurers in our industry, they say that they're, transforming care. They say that they're putting, the person at the center. They say that they're creating fully interoperable health records, to which I say nonsense. We have a complicated system that we make more complicated. And so the question and the challenge to all of us is, how do we simplify it? And I think we have to really take a clear-eyed look at ourselves and our own roles in everything. And that's the challenge leading into this year's AHIP, is to have the real conversation about how we contribute to the complexity instead of engaging in the finger pointing. Healthcare is an industry that is full of massive amounts of finger pointing. Sometimes it's the doctors that we blame. Other times it's the pharmaceutical companies. And surely there's certainly a lot of blame to go around, but I think we have an opportunity to look at ourselves and engage in a moment of self-reflection and ask ourselves, what do we do to make the system more complicated or difficult to navigate for patients? And we see it because we're all members of health plans ourselves. And we know what it is that we do to create the complexity that people call upon us to simplify.